Well, how you doing, Paul?
I'm feeling good. How are you?
All right. Well, what are we going to talk about today?
Let's talk about rehab.
All right, rehab. What's going on with that?
Well, in the office here, we work with people to rehab their spine. I think there's a general misconception about what rehab is. People come over thinking that we're going to treat them like they're at a gym and they want to get strong. But really what we're focused on in rehab is proper movement and correcting movement dysfunction. So we, in rehab, we usually start off by assessing the patient. We assess them for breathing, for different ranges of motion. And then we also work with them on how they're moving. So if we see something that isn't moving properly, we'll try to get to the foundation of why it's not moving properly. And most of the time it has to do with breathing. You'd be surprised at how many people breathe with their chest rather than the diaphragm where they're supposed to. Right. And this is a major cause of problems and dysfunction. So if we can correct just that, patients generally have an easier time doing daily activities in life, such as getting out of a car, standing in the grocery line, you name it. It's all based on simple movements that we get to correct here.
Now, there are times when the spine is fine, but maybe you're rehabbing a knee or a hip or something like that.
Yeah, definitely. We've done quite a bit of knees, shoulders. We get shoulders all the time. And the protocols for that are very basic, but they need to be done properly and consistently so that the patient gets the most benefit. We've had patients who have problems with their rotator cuff and need surgery, and so we help them get strong so that they can go into surgery strong, come out of surgery strong, and then rehab their specific joint after surgery and do it as best they can.
Is the rotator cuff injury, is that the injury that a lot of major league pitchers get?
Yeah,
Tommy John.
Tommy John's more of an elbow, but rotator cuff is it can be done. It's the shoulder's the most mobile joint in the body, and with mobility comes some vulnerability. So it's a joint that gets hurt a lot. People hurt it by definitely throwing, but there's accidents where people get the arm kind of yanked back and say jumping off of a cliff into water. Right. You hit the water, the arms go up. There's a shoulder injury there. Right. Snowboarding, skiing, we see a lot of shoulder injuries with that. Car accidents, we see quite a few. Slip and falls, we see shoulder injuries with that. Just it's a very vulnerable joint.
Right. So the process for correcting that specific joint is, how involved is that? What do people have to go through? Do you put them on machines, or is it all through hand? So
a lot. One major advantage to being in a chiropractic office is that we've got the chiropractic adjustment. That's the most helpful, I think, with shoulder injuries, is because it's going to reset the joint capsule and allow the shoulder to move properly. Now, the shoulder's stabilized by ligaments and muscles. So if there's tears in either of those, they need to be strengthened. The easiest way to work on that is to assess the movement, see what's causing the problem, and then you strengthen the shoulder muscles by doing very basic band exercises, rubber band exercises. The rubber band's connected to the wall. The patient pulls it with their hand, and you can isolate the shoulder muscles that stabilize the shoulder doing those exercises.
Now, if I came in and I went through this whole process, would you send me home with some homework?
We would eventually, but we want to make sure that you're doing the movements properly in the office before we let you loose and do them at home. We might give you some restrictions at first, no overhead presses, things like that. Right. Make sure that you're sleeping with your elbow close to your side rather than up here, because there's some injury in the shoulder and we just don't want to hurt it. But the whole purpose of you coming into a chiropractor office is to be free to do the things that you want to do. Right. So we may give you some homework, but eventually that's going to be after we know that you can move properly.
On a rotator cuff injury, the average one, and I realize everybody's different, but generally speaking, somebody that gets serious about it and they come in and they do everything you tell them to do, how long does it take before they really start feeling good?
Oh man, everybody responds differently. Right. It really depends on how injured the joint is. Obviously, the less injury or the younger the patient, the quicker they are going to respond to the treatment. Right. A child with a shoulder injury, a minor shoulder injury, and then an adult with the same shoulder injury, same degree of injury, is the child's going to respond much faster just because of the child's age. Right. Compared to a male or female that's 50, 60 years old. Right. But they progress. Even though they progress differently, the goal is the same, to get them moving exactly how they should. Right. Yeah.
All right. Well, thank you so much, Paul.
You're very welcome.
We appreciate for this great information that you've shared with us today.
Thanks for inviting me.